Question 1. A nurse is preparing a controlled substance for administration. What is the best action if part of the dose needs to be wasted? A. Discard the remainder in a sharps container. B. Have another nurse witness the waste. C. Document the full dose as given. D. Return it to the medication room. Answer. B. Have another nurse witness the waste. Question 2. A patient is prescribed 2 medications that have known interactions. What is the nurse's priority action? A. Call the pharmacist for clarification. B. Administer them at different times. C. Notify the healthcare provider. D. Document the medications separately. Answer. C. Notify the healthcare provider. Question 3. What action shows that a new graduate nurse understands the right time of medication administration? A. Giving all medications together. B. Administering medications within 30 minutes of scheduled time. C. Skipping the dose if the patient is asleep. D. Relying on the patient to request medications. Answer. B. Administering medications within 30 minutes of scheduled time. Question 4. A nurse is preparing to give a patient a transdermal patch. Which action ensures safe administration? A. Apply the new patch over the old one. B. Place the patch near a bony prominence. C. Rotate sites to prevent skin irritation. D. Shave the site before application. Answer. C. Rotate sites to prevent skin irritation. Question 5. A nurse receives an order for a medication in micrograms, but the MAR shows milligrams. What is the nurse's next step? A. Convert the units independently. B. Administer the microgram dose. C. Call the pharmacy. D. Clarify the order with the provider. Answer. D. Clarify the order with the provider. Question 6. A nurse is giving an intramuscular injection. Which step best promotes patient safety? A. Use a 30-gauge needle. B. Massage the site after injection. C. Choose the correct anatomical site. D. Insert the needle at a 45-degree angle. Answer. C. Choose the correct anatomical site. Question 7. A patient develops hives after receiving an antibiotic. What is the nurse's priority action? A. Notify the provider. B. Administer diphenhydramine. C. Stop the antibiotic immediately. D. Document the reaction. Answer. C. Stop the antibiotic immediately. Question 8. The nurse is giving a medication that lowers blood pressure. What should be assessed prior to administration? A. Oxygen saturation. B. Blood glucose level. C. Respiratory rate. D. Blood pressure and heart rate. Answer. D. Blood pressure and heart rate. Question 9. A nurse prepares to give a crushed medication through an NG tube. Which action is correct? A. Crush all medications together. B. Flush the tube before and after each med. C. Mix meds with tube feeding formula. D. Give meds without flushing. Answer. B. Flush the tube before and after each med. Question 10. A nurse is teaching a patient about a new medication. Which method is most effective for verifying understanding? A. Ask if the patient has questions. B. Provide written instructions. C. Use the teach-back method. D. Tell the patient to read the label. Answer. C. Use the teach-back method. Question 11. Which of the following requires immediate intervention during medication administration? A. A patient questions the pill's color. B. A patient takes the medication with juice. C. A patient asks for a drink of water. D. A patient swallows before scanning their ID band. Answer. A. A patient questions the pill's color. Question 12. A patient on digoxin complains of nausea and blurred vision. What is the nurse's priority? A. Give the next dose early. B. Check the digoxin level. C. Administer an antiemetic. D. Recheck vital signs in 30 minutes. Answer. B. Check the digoxin level. Question 13. What should a nurse do if a patient's MAR shows a medication the patient says they never take? A. Withhold the drug and notify the provider. B. Administer the drug as listed. C. Double-check the pharmacy label. D. Ask the family to confirm. Answer. A. Withhold the drug and notify the provider. Question 14. When should a nurse use the 3 medication checks? A. After giving the medication. B. Before entering the patient's room. C. Before preparing the medication, before administration, and at the bedside. D. When scanning the barcode only. Answer. C. Before preparing the medication, before administration, and at the bedside. Question 15. What is the most important reason not to give a patient someone else's medication? A. It could cause resistance. B. It may be out of date. C. It's a legal and safety violation. D. It might taste bad. Answer. C. It's a legal and safety violation. Question 16. A nurse receives an order for a drug the patient is allergic to. What is the correct initial action? A. Document the allergy in the chart. B. Administer it with caution. C. Notify the pharmacy. D. Contact the provider immediately. Answer. D. Contact the provider immediately. Question 17. Which action demonstrates safe use of a medication dispensing system? A. Removing medications for multiple patients at once. B. Documenting administration before giving the drug. C. Logging off the system after use. D. Sharing login credentials with coworkers. Answer. C. Logging off the system after use. Question 18. A nurse receives a new medication in a syringe without a label. What should the nurse do? A. Use it if it matches the order. B. Label it after drawing up the medication. C. Discard it and report the incident. D. Ask another nurse to identify it. Answer. C. Discard it and report the incident. Question 19. A nurse gives the wrong medication, but the patient is stable. What is the next step? A. Notify the provider and monitor the patient. B. Wait to see if symptoms develop. C. Tell the patient not to worry. D. Avoid documenting the error. Answer. A. Notify the provider and monitor the patient. Question 20. What is the best practice when administering oral medications to a confused patient? A. Hide the medication in food without informing. B. Have a family member administer it. C. Explain each medication simply and clearly. D. Skip the dose if the patient resists. Answer. C. Explain each medication simply and clearly. Question 21. What should a nurse verify before administering insulin to a patient with type 1 diabetes? A. Blood glucose level. B. Respiratory rate. C. Bowel sounds. D. Potassium level only. Answer. A. Blood glucose level. Question 22. Which nursing action represents a violation of safe narcotic administration? A. Locking the medication cart when not in use. B. Documenting the administration after giving the dose. C. Counting narcotics with another licensed nurse at shift change. D. Leaving a controlled drug on the bedside table. Answer. D. Leaving a controlled drug on the bedside table. Question 23. A nurse is preparing to give a look-alike, sound-alike medication. What is the best safety strategy? A. Store them together for easy access. B. Ask the patient to confirm the name. C. Use tall man lettering and barcode scanning. D. Use only the generic name. Answer: C. Use tall man lettering and barcode scanning. Question 24. Which error is most likely when a nurse is distracted during medication preparation? A. Delay in discharge. B. Failure to document medication. C. Wrong medication or dose administered. D. Repeating patient education. Answer: C. Wrong medication or dose administered. Question 25. What is a priority nursing action when preparing to administer a medication via central line? A. Flush the line with saline after medication. B. Assess for bowel sounds. C. Ask the patient to take a deep breath. D. Administer the medication quickly. Answer: A. Flush the line with saline after medication. Question 26. A nurse receives a verbal order during an emergency. What must occur for this order to be valid? A. Another nurse must verify the order. B. The provider must sign the order within the required time frame. C. The patient must verbally agree. D. The order should be witnessed by the charge nurse. Answer: B. The provider must sign the order within the required time frame. Question 27. Which situation requires the nurse to withhold the medication and notify the provider immediately? A. Patient requests to delay medication. B. Patient's blood pressure is below prescribed limits for antihypertensive medication. C. Medication label has a smudge. D. Medication is difficult to swallow. Answer: B. Patient's blood pressure is below prescribed limits for antihypertensive medication. Question 28. What action should the nurse take when a patient refuses a scheduled narcotic for pain? A. Document the refusal and discard the dose. B. Offer the medication in a different form. C. Reassess the pain and notify the provider. D. Encourage the patient to take it later without reassessing. Answer: C. Reassess the pain and notify the provider. Question 29. A nurse administers a medication and later realizes it was given at the wrong time. What is the nurse's priority response? A. Report the incident and monitor the patient. B. Ignore the error if no side effects occur. C. Document that it was given correctly. D. Wait until the next dose to inform the provider. Answer: A. Report the incident and monitor the patient. Question 30. A patient on warfarin therapy is scheduled for surgery. What is the nurse's priority concern? A. Risk of infection. B. Inadequate pain control. C. Increased bleeding risk. D. Postoperative nausea. Answer: C. Increased bleeding risk. Question 31. What is the best method to verify correct medication dosage for pediatric patients? A. Ask the pharmacist to calculate it. B. Use weight-based calculations and double-check. C. Use the adult dose for adolescents. D. Divide the adult dose in half. Answer: B. Use weight-based calculations and double-check. Question 32. Which delegated task to an LPN requires intervention by the RN? A. Administering oral medications. B. Assessing a patient after receiving a new medication. C. Monitoring for fluid rate. D. Giving scheduled subcutaneous injections. Answer: B. Assessing a patient after receiving a new medication. Question 33. A nurse finds an unlabeled syringe at the bedside. What is the correct action? A. Give the medication based on the March B. Ask another nurse if they prepared it. C. Discard the syringe and report the incident. D. Return it to the medication cart. Answer: C. Discard the syringe and report the incident. Question 34. A nurse receives an order for a high-alert medication. What action is most critical before administering? A. Check for nausea. B. Perform a second independent dose check. C. Document side effects first. D. Ask the patient if they've taken it before. Answer: B. Perform a second independent dose check. Question 35. A nurse is educating a patient about a new opioid prescription. What statement by the patient requires further teaching? A. I should avoid alcohol while taking this. B. I will take it with food to avoid nausea. C. I'll stop it immediately if I feel sleepy. D. I'll increase fiber to avoid constipation. Answer: C. I'll stop it immediately if I feel sleepy. Question 36. Before administering morphine, which assessment is most important? A. Respiratory rate. B. Skin turgor. C. Temperature. D. Bowel sounds. Answer: A. Respiratory rate. Question 37. A patient is prescribed a drug with a narrow therapeutic index. What is the nurse's priority? A. Administer on an empty stomach. B. Monitor drug levels closely. C. Give at night to reduce side effects. D. Avoid giving with water. Answer: B. Monitor drug levels closely. Question 38. The nurse is administering a potassium supplement. Which finding requires the nurse to withhold the drug? A. Pulse of 68 BPM. B. Potassium level of 3.5 milliequivalent/L. C. Potassium level of 5.6 milliequivalent/L. D. Urine output of 50 milliliters per hour. Answer: C. Potassium level of 5.6 milliequivalent/L. Question 39. A patient is receiving 4 antibiotics and reports pain at the site. What should the nurse do first? A. Slow the rate. B. Flush the 4-line. C. Stop the infusion and assess the site. D. Apply a warm compress. Answer: C. Stop the infusion and assess the site. Question 40. A nurse is giving digoxin to a patient with a heart rate of 56 BPM. What is the appropriate nursing action? A. Hold the dose and notify the provider. B. Give the dose and monitor BP. C. Encourage deep breathing. D. Ask the patient to ambulate. Answer: A. Hold the dose and notify the provider. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.